Hi, my name is Kaylee Bell, and I'm going to be giving my interpretation of test scores for my secondary student named Sally Brand. My student, Sally Brand, is a 12-year-old student. She is in the 7th grade in a self-contained classroom. Her birthday is 6/26 of 2009. As I said, she receives her special education services in the self-contained classroom. Sally is the youngest child of four siblings. She has two older brothers and one older sister. She is a twin. Her older brother, who we are going to call James, was born first, and then she was born after him. Sally has been explained to have a normal um, home life. Her mom works a part-time job at the local Family Dollar store, and her dad is a CDL driver. He does work away and stay home very often, so her mom is the main person or adult in her life. Her dad does come home once a month, um, but both parents have been actively described to be active in her education. At birth, Sally and her twin were born via C-section. Her and her twin brother were born at 36 weeks gestation. Her mother was put on bed rest beforehand to stop progression of labor because her water broke at 35 weeks. Sally's mother was diagnosed and with gestational diabetes, which she managed with insulin, but both twins stayed in the hospital after delivery for observation due to make sure of proper growth, and they had to be monitored for infant jaundice due to excess bilirubin. Sally and her twin brother, both as infants, were hitting normal milestones, but Sally was hitting them later. As they continued to progress in their life and they're growing, her brother James was hitting those milestones, and Sally slowly started to not hit milestones like her brother James. They got just less and less. Sally's mom grew concerned and took her to the doctor. And at 8 months, she was diagnosed with Noonan syndrome and a disruptive behavior disorder. She was diagnosed at 2 years. And then at the age of 6, she was diagnosed with autism. Sally currently weighs 119 pounds and is 3 feet and 8 inches tall. She has been also diagnosed with persistent protremia and hermetria. This diagnosis was just a recent sickness that was found out last year in 2020. She struggles with frequent sickness due to this. This sickness mainly is a kidney diagnosis. Her kidneys have failed or are failing. Due to Sally's short, stockier build, this is with the Noonan syndrome. She also has the appearance of really dry, curly hair. So that is a background on Sally. Sally has been a resource student since she entered kindergarten. With her diagnosis of autism, she started out in the self-contained classroom because she was not potty trained when she entered kindergarten. Once she was potty trained and they were moving to first grade, at her annual review, she was transferred into the resource setting instead of the self-contained setting. She also was placed for speech, occupational therapy, and physical therapy. Sally continued doing all the therapies and being a resource student for math, reading, and writing from first grade all the way up until sixth grade. When she transferred into seventh grade this year, she was placed back in the self-contained classroom due to just some backwards progression. She started wetting herself due to her kidney issues diagnosis. And she had been a virtual student in the 6th grade, so her progression declined. She also was getting to the age where her mom felt as if she needed to be learning how to be living on her own and make her goals more life-based for the real world. She expressed the need of Sally learning how to care for proper feminine hygiene, as that is a goal for her now. She does have academic goals, but most of her goals do express the need for learning your everyday skills. She still is continuing her occupational therapy and physical therapy for 60 minutes per week, and her speech is 60 minutes per week. According to the IEP, Sally is in the regular classroom less than 40% of her day. It is also stated that she struggles with social cues and attention. She feels as if the attention needs to be on her at all times, and she does the act out so that way she can get the attention she needs. According to Sally's testing or current testing, she's below grade level. She was tested when she was first placed, which was in 2015. Her occupational physical therapy and speech language evaluation is more current as it is in 2019. According to Sally's EDR and EPCs in her file, her testing was rolled over for psych evaluations or confidential testing in 2018. And in 2021, it was rolled over again. So her testing that the school is going off of for her educational placement is actually 6 years old. I was kind of concerned about that whenever I seen it, but here are the results. An intellectual and cognitive assessment was given. The Stanford Binet Intelligence Scale, the 5th edition. So this test measures the intelligence scale for cognitive abilities. This test can be used for ages 2 years and 0 months to 89 years and 11 months. This scale provides a full IQ, a nonverbal, and a verbal domain IQ. It also scores 5 factors being fluid reasoning, knowledge, quantitative reasoning, visual spatial processing, and the working memory. The test itself is a non-referenced assessment tool that can be used to measure general functioning, cognitive functioning, identify developmental disabilities, and exceptional abilities in children, adolescents, and adults. It can provide clinical and neuropsychological assessments. It can research your ability. It can assess early childhood conduct and psychoeducational evaluations for special need children or individuals. It can provide adult social security evaluations, support worker compensation evaluations, and inform career assessments. In our case, it is working for the special education, full IQs, nonverbal standard score, a nonverbal standard score IQ, a verbal standard score IQ, and a full scale IQ. Sally received this test and got a score of 90, which was in a decent range for her age at the time, and a verbal standard score of 76 and a full scale standard score of 82. She also had an academic achievement test. This was the Kaufman Test of Educational Achievement number 2. This test is individually administered and an in-depth evaluation of key academic skills. It also measures progress or response to intervention and supports identification of learning disabilities to assess the academic of individual achievement for ages 4 years and 6 months through 25 years and 11 months. Sammy was given this to measure the achievement in her abilities of reading, written language, oral language, and mathematics. Sammy scored on her word identification standard score a 79, on the math concepts and application a standard score of 76, written expression a standard score of 40. She was also given another academic achievement test, the Woodcock-Johnson number 3 NU test of achievement. This achievement test determines students' current skills in reading, writing, and math. The starting points are determined by the current grade level. Therefore, not all students are asked to complete specific items of this test. This test has a mean of 100 and a standard deviation of 15, and scores of 131 and above are considered very superior. 121 to 130 are considered superior. 111 through 120 are high average. 90 to 110 are average. 80 to 89 are low average. 70 to 79 are low, and scores at 69 are very low. Sally was given this test administered to assess all of her achievement levels in individual areas in the area of reading, math, and writing. Her standard scores were passes comprehension 95, applied problems 85, and writing samples 73. In the social aspect, Sally's mother filled out a social history form, and this happened for her initial placement in kindergarten. This form was given to allow Sally's mother to give family history, medical history, and educational history, and current information such as the address and phone numbers. I explained all of that in the very first part of this video to allow you to know about Sammy and her family. An updated social history was also given in 2019, and on the social history, her mother identified that no changes occurred for Sally or their family. For Sally's therapies, she qualifies in occupational, speech, and physical therapy. She goes 60 minutes per week in all 3 of those. A speech language assessment was given in 2019. This assessment, during this assessment, the voice and fluency informal assessment was given. This informal assessment of voice and fluency was conducted during structured and spontaneous tasks. The purpose of this exam was to assess pitch, loudness, voice patterns, and fluency in Sally's speech. According to the observations, Sally's pitch and loudness were judged to be within normal parameters. However, she did use a baby talk voice, and her fluency was within normal limits for her age and gender, but her voice pattern is considered to be inappropriate for her age. She was also given an orofacial examination. This assessment of structures to allow speech production, and it assesses structure and function and integrity of the orofacial mechanism. During this examination, all structures and functions examined were within normal limits for her speech production. The Arizona Articulation Proficiency Scale was given. This assesses 67 phonemes and diphthongs produced in the initial, medial, and final position of words and sentences. This average standard score is 100 with a standard deviation of plus or minus 15. The purpose of this exam is it gives the present level of Sally's articulation skills in single spontaneously produced words. Sally received a total score of 94, which yielded a standard score of 82. This placed her in the 12th percentile and indicated just a mild delay in articulation abilities. Another test of language development was given. It was the intermediate fourth edition. This is a non-reference expressive and receptive language assessment. The battery test for children and young adults ages 8 through 17 years old. This provides an in-depth analysis of the sematics, syntax, phonology, pragmatics, and linguistic systems. This also gave a standard score of 100 with a standard deviation of plus or minus 15. The purpose of this exam was to assess language skills and identify children who were significantly below their peers in oral language proficiency, and also to determine their specific strengths and weaknesses in oral language skills and document their progress in remedial programs. Sally received a moderate severe delay in expressive and receptive language abilities. The composite subtest scores were listening 78, which was considered poor, organizing 65, which was very poor, speaking 80, which was below average, grammar 68, which was very low, sematics, which was 75, which was poor, spoken language, which was 68, which was very poor. The last language exam was given clinical evaluation of language fundamentals. This standardized school test is for ages 5 to 21 years and 11 months. This subtest scale scores are based on a mean of 10 and with a standard deviation of plus or minus 3. Standard scores between 85 and 115 are considered to be very average. This purpose of this exam, it measures the basic foundations of content and form that characterize mature language use. The core language test scaled score and impressions are as follows. The word class was 6, below average. Formulated sentences was 4, which was low. Recalling sentences is 5, it's low. Semantic relationships 4, low. Following directions was average at a score of 10. The sentence assembly was 3 and very low. Based upon these tests, Sally was referred for 60 minutes of speech therapy. The adaptive behavior assessment that was given was an adaptive behavior evaluation scale. It was the revised second. The adaptive behavior was given as a home test and also a school version. The general measure of the adaptive behavior is made up of 10 adaptive behavior skills. The standard scores below 7 or above 13 are considered statistically atypical and indicate a serious adaptive skill defect. The purpose of the adaptive behavior was comprehending typical verbal communication, social domain skills related to social compliance, and practical domain independent living skills. The scores include domain quotients and a descriptor. Her conceptual adaptive behavior ended up being a 96, which was considered average. Her social was 84, which was below average. A practical score of 88, which was average, and a total score of 87, which was considered average. Based upon the information provided, Sally displayed an average overall adaptive behavior in the school setting. The occupational and physical therapy evaluations were given. We are first going to start with the occupational therapy. The occupational assessment given was the Brunick-Ostrowski test of motor proficiency 2. This was an individually administered test that uses engaging goal-directed activities to measure a wide array of motor skills in individuals aged 4 through 12. The purpose of this test was to measure fine motor precision, fine motor integration, manual dexterity, upper limb coordination, bilateral coordination, and balance. The motor area composite score and descriptive category were as followed. The fine motor control was 25, well below average. The manual coordination was 33, which was below average. A developmental test of visual motor integration was also given. This is a standardized instrument to assess an individual's visual motor skills for ages 3 to adult. It includes two supplemental standardized tests, the VMI, visual motor perception, and the VMI, motor coordination. On the VMI, standard scores that fall in between 133 to 160 are considered very high. 118 to 132 are high. 83 to 117 are average. 68 to 82 are low. 40 to 67 are very low. The standard score has a mean of 100 with a standard deviation of 15. The purpose of this test is to allow the child to test to perceive objects and then copy these objects accurately. The test begins with simple geometric designs like lines and circles, but moves to more complex and overlapping figures. Sally's standard score on VMI and motor coordination were 67, 75, and 56. Sally's standard scores are considered in the low average range. The last testing for occupational therapy was the print tool. This was a comprehensive evaluation on handwriting for ages 6 and older. The print tool assesses 8 basic handwriting skills, which include memory, orientation, size, start, sequence, control, and spacing. Sally writes with her right hand. She uses her left hand to assist in the paper stabilization. She usually applies adequate to heavy pressure to the pencil when writing. Suggested handwriting expectation of an 8-plus-year-old child, according to the print tool. Her overall score was 61%. A clinical observation was also done for occupational therapy. The informal observation of related skills such as movement, posture, behavior, hand, dominance, and pencil grip. The purpose was to assess movement, posture, behavior, hand dominance, pencil grip. The outcome of the observation said that Sally was cooperative during the therapy sessions, and she was also cooperative throughout the evaluation process. It was felt that she performed to the best of her ability and that the evaluation is an accurate reflection of her functional abilities. The physical therapy evaluation that was conducted, the first assessment is the Brunick-Osterskag test of motor proficiency 2. This test was also the test given in occupational therapy. However, they used the gross motor development for the purpose as opposed to fine motor development. This test measures a wide array of motor skills in individuals ages 4 through 21. The findings based upon her scores of testing related Sally's gross motor skill in the less than 4 to 5 year and 11-month range. This represents a significant delay. She was also given the assessment of geometric measurements. This measurements of range of motion in a joint with a genometer. The purpose of this test is for range of motion, and the description allows range of motion within arms and reach and legs reach. Her score and findings were based, and they had a significant delay. A clinical observation was also done to assess skills such as movement, posture, behavior. The informal observation of related skills such as movement, posture, behavior was also the description given. Her score follows that she was cooperative in the assessment, she followed direction and worked hard. It was noted that she exhibited lumbar hyperlordosis and elevated shoulders bilaterally. Morphology of the head, neck, and trunk is consistent with her diagnosis, the diagnosis being Noonan syndrome. After conducting the I'm sorry. After reading through and getting the findings of the testing, it was concluded the delays in these specific areas that qualify her for special education in speech and occupational therapies were math, reading, and writing. She has the diagnosis of autism and was placed under the eligibility category. When tested for intellectual, Sally's full skill IQ had the standard score of 82, and the academic achievement she scored in a low range or below for all subjects. According to her testing, not only does she qualify under the eligibility category of autism, reading, writing, and math show significant delays, which allow her to qualify for special education services. Her adaptive behavior was within normal limits, and she does not need a behavior goal at this time based upon her behavior in class and her attitude, as well as observations that were done. Thank you.